Are you having a hip groin pain, hip instability, pain that goes down your leg or your inner thigh and sometimes all the way to your think it's a sciatic nerve? Maybe it's your obturator internus. Welcome back to my channel, Annie Pilates Physical Therapist. Today I'll be discussing about the obturator internus, the anatomy, and how to strengthen and stretch this muscle. So get your mat ready and join me. So let's discuss first about the anatomy of the obturator internus. It's a very deep muscle. It's part of the pelvic floor. This is all the way here. It starts at the pubis area and the ischium of the membrane of your pelvic bone, and then it wraps around like a boomerang shape and inserts on the medial aspect of your greater trochanter of your femur bone, which is your thigh bone. I know it wraps around all the way through, but it's so thin, and it helps abducts while your hip is in flexion, which means it opens, as well as external rotate, which is a slight movement up with your hip in extension. So when this is tight and sometimes inflamed because of the weakness and rubbing, there's a membrane there, the ischial membrane, that gets inflamed, and sometimes it's mistaken as a piriformis syndrome because the piriformis muscle is just above it, posteriorly, and then sciatic nerve that passes behind it, the piriformis, and then in front of the obturator internus. So what happens with this problem? It causes sciatica. So if you've been treating your back pain and you're still having pain going down your leg, maybe you need to target this muscle to help out. And then if you have weakness on this muscle, the acetabulum gets unstable, so your walking pattern on your one side, usually when you play sports, you feel like a clicking sound or an instability. So the first exercise that we're gonna do is the side-lying open kinematic chain. So in this position, you're gonna put your foot out like this, stabilize pushing it down to stabilize more your pelvic, and then bend your knee here and slowly lift it up. And my recommendation, without your knee lifting, keeping your chin tucked, posterior pelvic tilt to keep your spine straight, belly button in with your breaths, inhale through your nose and blow, and do this up to 50 times. 50 because it takes a lot of repetition to get results for this tiny muscle. And the nerve that innervates this muscle is from L2, 3, 4 if you have low back pain on one side, in left side, and it irritates this nerve, and this nerve that originates on this area of your lumbar spine becomes the obturator internus nerve, and if you have that nerve damage, it causes weakness on that muscle as well. So sometimes you need to stretch and strengthen your obturator as well as strengthen your spine, and you can check out my low back treatment plans on my playlists. So after 50 times and it gets easier, now you can progress with isometrics. Isometric means you put resistance, and the first area you're going to put resistance is in your knee. And hold it for 5 seconds. Hold again up to 50 times. And then as day goes on, it gets easier. Then you can start resisting on your medial aspect of your leg. And then you go further up to your ankle. And then if it gets too easy, then you're on your toes. Then for me, this is still very difficult because I have a problem on my obturator internus on my left from low back pain years ago. And then I need to continue with this as my program to keep it healthy and strong. And the next progression is putting ankle weights on your knee area first. And then you can slowly place it further away from your knee. And another great idea is to get the resistance band and someone holds on the outside part. So you pull it out, you tie it down on the floor somewhere. You can stabilize on the furniture and you put resistance around it like this. And up to 50 times as well. And the progression in this one is getting a bolster and placing it underneath your knee. So when you put it underneath your knee, still in 90 position, you have more range of motion and you can really elevate it up. So when you stretch your obturator internus, and in this position, you get more range and it's much more difficult. I know I'm very flexible now. I've been doing this for a long time. But if you're a beginner, it's okay. If it's low, do it as much as you can. You can also lift with your hand to stretch it out. And it feels a lovely stretch on your obturator. So the next one is sitting up. So this is called the Mermaid Stretch. So if you're targeting at the back of your leg, which for me is my left side, I have to put it behind me. So it's called Mermaid because it looks like a mermaid, but in a 90 position. So 90 degrees on your knee, 90 degrees on your hip, on your knee as well at the back, and your hip. So you feel already a stretch, just trying your best to sit up because of the tightness, the foundation of your spine, which is your pelvic area, and your hip. So just holding it here, take a deep breath through your nose and blow, and hold it there up to 10 breaths. And then slowly progress with your hands, pulling it up in this position, pointing down to the floor with your fingers and down. And up and down like this for 10 repetitions with your breath. So take a deep breath up and down, blow. Feels a lovely stretch on my hip area. And it really pushes it in a close kinematic chain to stretch the obturator internus. And now we're going to progress. You're going to turn and twist towards the left side where I have the problem. And then back to the center with your breath. So you take a deep breath up, turn, and back to the center and blow. And my recommendation again is up to 50 times, 3 sets. So after doing this, the next progression is lift, turn, and open your knee out. And you can really feel the tension on your obturator and your inner thigh. And do that as well for 50 times as you progress. And then with your hands out like this and lifting, you feel this is a little bit more challenging, and you'll be surprised on our body's biomechanic that this gets harder with your palms out. And when you turn, it's another progression that you can progress as well once you found that this is easy. So this is the progression and lift. And of course, I love the isometric. So you're going to put resistance on your behind your knee to target and hold it for 5 seconds, up to 10 seconds hold as you get better with less, as long as there's no increasing pain and you just feel some muscle resistance up and resistance over here, and then down and turn. 50 times as well to challenge your obturator internus. And the last one, you'll be lying down. So I'm gonna target my left obturator internus. So the obturator internus, when your knee is straight and down, your muscle is actually slack. It's not tight in this position. But once you start bending it, that's when it gets taut and you feel the pain on deep inside your hip. So you're gonna use the bolster here as a self-massage. I'm gonna target my left, so my right side will be stabilizing it, and then I'm gonna go up and down just to stretch. And then I'm rolling it gently on my glutes area because it's behind those deep, it's a very deep muscle behind the glutes. And when I go straight, it's really relaxed, the obturator. And when I bend fully and pull it back, I could really feel the stretch. And then if I turn inwardly, you feel a stretch. I could feel it more when you pull it towards your chest like this. And then down. Whew, what a stretch. So bend fully and pull inwardly to stretch your inner. You can feel the inner thigh pull of the muscle and down. So again, I'm going to slowly bend and twist back to the center and hold it up to 10 seconds hold. So bend, twist, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Back to the center and down. Last one. So you're gonna bend, hold it here, pull, feel a stretch, and progress. Twist inside, and then another progression. You open it out for self-massage, mobilizing your hip, the acetabulum, and then down. So those are the muscles, the obturator internus stretch that I showed you how 3 simple exercises that you can do at home to strengthen and stretch this deep, lovely muscle that's being neglected. And once you start treating this, maybe you feel better on your sciatica as well as maybe your piriformis syndrome as well. Please like and subscribe my channel. Ring the notification bell for future updates just like this one. I upload videos every Wednesdays for Pilates and physical therapy treatment plans, Friday for advanced Pilates and some yoga, and Sundays or sometimes Mondays for beginners. You can also follow me on my social media accounts. I have my Facebook, Reddit, and Instagram. Check out what's going on in my life and how I do my Pilates and physical therapy, yoga, and wellness and health advice for the week. Thanks again for watching. Have a great and healthier you. Bye!